That's
No.
not the brightest thing.
Oh my gosh, what is she doing?
What in the ruin in your braces is going on here?
Please do not brush your teeth after your coffee.
I'm a coffee drinker, so this is a sensitive topic for me.
Oil pulling can help to heal the gums.
Look, she has a point.
Make no mistake, your partner's oral health affects your oral health. Here's what you need to know.
Yeah, I'm on my partner's case to check his oral microbiome. He's like, oh no, I'll do it another day. I'm like, I booked him in. I'm Dr.Maria Florou, and this is Mind Your Mouth. I'll be sharing with you the truth about oral health that most people completely overlook. If you're ready to go beyond the basics, challenge the myths, and truly transform your well-being, let's get started. Hi guys, I'm here on this episode again to talk about some trends that are on the internet. It's the first time I'm going to watch this again with you. Thank you for watching to our last one. So we're doing this again for you today. Let's see what's here.
I'm Dr. Baird. I'm a board-certified plastic surgeon. And why am I taping my mouth shut? Well, I'm going to tell you all about that in the end, and I can tell you how to start doing this once you hear about all the benefits at the end of this video. I started taping my mouth shut after I read a book called Breath by James Nestor, and it talks about all the benefits of breathing through your nose versus breathing through your mouth. At nighttime, I breathe through my mouth. I'm a mouth breather. I hate to admit it, but I am. I figured out ways to, I try to get like a little harness to kind of keep my mouth shut, but I found that tape works the best.
All right, guys, I'm going to pause straight. Look, as we mentioned before, nose breathing is ideal. Yes, we should train our muscles to nose breathe all the time. And when I say muscles, does it make sense to you? What I mean is the muscles of the mouth need to be strong enough so the lips are sealed together in a relaxed way all of the time, even when we're asleep. Yes, even when we're asleep and we are relaxed. If we trained our muscles, they would be doing this automatically. And there are exercises for that. There are ways of doing that. Look, there is a big talk, a big trend about taping at nighttime. I'm not the person who suggests that. What I suggest and what we teach, and there are a lot of ways of learning this, is by exercising. And there are ways like simple things like holding on something light, like a pop stick, just holding with your lip for maybe 5 minutes until you get tired, and then releasing your lips is one of the exercises. Things like, there are lots of exercises that you can do to strengthen your lip muscles. It goes beyond that though. The tongue has to be sitting on the roof of the mouth. When it comes to taping though, look, breathing is vital. So what I want you to do is be able to breathe. If someone has obstruction on their nose and then cannot breathe through the night, you don't want to be taping your child if they have a blocked nose, if they can't breathe through the nose. I don't advocate for taping, but I know that a lot of people do, and these are my reasons. I'd rather take the Band-Aid off and train the muscles rather than relying on the tape. So let's watch.
And I saw a lot of improved benefits. I slept better. Some other reported benefits of it are you actually improve the release of nitric oxide. You help
that's
stimulate
so
your
true.
parasympathetic
That's
activity.
so true. And that's why breathing through the nose is really, really important. I have to say here that the team has picked this video, so this is all a surprise to me.
My allergies went away. So if you have a lot of allergies and things like that, if you have a stuffy nose in general, forcing yourself to breathe through your nose, at least for me, was able to reduce that. Now, that may or may not work for you, but if you're interested in starting taping your mouth shut at nighttime, start small, start with a tiny little piece. Like medical tape is a really easy thing to do. You can get this blue silk.
Guys, I'm going to stop here because he's just going to go ahead on explaining how the tape works. And I don't advocate for that. So I'll leave it up to you. If you want to watch it, go ahead and watch it. If it's something you want to do or try, go ahead. My reasons for not trying are the ones that I've just mentioned before. I don't want to rely on a Band-Aid fix, and I don't want to risk any harm if someone has some blockage, some physical thing happening there where they can't breathe well through the nose. Let's keep in mind breathing is vital, ideally through the nose. Real quick, your mouth is the gateway to your overall health, and at Casuarina Dental, our focus is on you. If you're ready for a holistic approach to dental care, book your appointment now via the link in the show notes. Now, back to the episode.
Okay, third try. I have to have something. Why does my breath stink?
Ask
Well,
me
I'll
my
tell you why your
friend.
breath stinks, because you got tonsil stones, and as you can tell, my man's having a hard time getting them out. And in fact, I had the same issue because I had bad breath all the time. My wife still tells me today,
Hey, your breath stinks. Go get your tonsil stones out.
and just like this kid, I was stuck in the bathroom poking, squeezing, pushing, and hurting my tonsils.
All right. look, it's a little bit outside of my area of expertise, this one. What I can say to you is don't go poking them. Talk to your doctor, gargle a little bit there. Gargling is going to actually help clean out some plaque from the back of your mouth there, and that's a good way of preventing stones. But yeah, look for a health professional and get that sorted, because that's actually bacteria and build up, mineralized, calcified, sitting at the back of your throat there. Oh my gosh, what is she doing?
What in the ruin in your braces is going on here? And it looks like the people in the comments agree. We've got, are you supposed to do that? And somebody said, that's not the rightest thing to do. And I will agree, it's probably not smart to do because it's basically ruining your braces treatment.
Guys, one thing to understand is that the wires that go on your braces, they are millimetrically calculated. All forces applied to them will change the position of your teeth. Do not stuff around with that. Do not play with your braces, with wires. Do not try to DIY on that. Go to your dentist and have them looking after whatever is going on with you, especially when it comes to braces.
On there are actually very similar to what we call power chains. They're just a metal tie version of power chains that hold all those teeth together. Not only that, but she has the wire completely out. She's going and cutting and all sorts of crazy things. Who knows where those pliers have been? I don't think that meets the health codes at all. But seriously, I get it, guys. I get that braces are annoying or it's poking you or whatever else, and so you're just like, I'm gonna take this into my own hands and I'm just gonna rip them all off myself. Probably not the smartest idea though, because all it's gonna do is set you back in treatment and cause you to be in braces even longer. And lastly,
that is right, and that can move the roots of your teeth, and it can cause a whole lot of problems. So do not go ahead, do not do that. I agree with him 100%.
Please do not brush your teeth after your coffee. Wait for 30 minutes. Most of you
All right, guys, I'm gonna pause right now. I'm a coffee drinker, so this is a sensitive topic for me. Let's look at this.
Most of you were shocked when I said you should not brush your tooth after drinking coffee. Coffee naturally is acidic, and coffee also known as to stain teeth. And both together, we don't want this to happen. When you drink coffee, which is an acidic, and then straight away you brush your teeth.
Yes, coffee is naturally acidic. However, the acids change depending on what you put on your coffee. So depending on the type of milk, if you use any milk or not, I would not recommend brushing your teeth straight after coffee or anything acidic, as we mentioned on other videos. But let's keep watching.
Your pH in the oral cavity is low. So your outer enamel surface layer, it will dissolve with it. And with mechanical scraping, you will remove the tooth surface and you are harming your teeth more. So you need to...
Again, just for you that haven't watched our previous video, when we talk about the strips where we can measure the pH of the saliva, go ahead, check that. But just to give you a brief here, there are some strips that you can buy that help you measure the pH of your saliva whatever time of the day. Ideally measure it at least half an hour after eating or drinking anything, because that's how you know the actual pH of your saliva. But if you're curious to see how your coffee is acting and the influence that's having on your saliva pH, go ahead and check that straight after your coffee. That's a good way of finding out. But definitely, if we have acidic exposure, do not brush straight after. Let's see.
Allow your body to have a natural process of remineralizing the outer surface. You need to wait for 30 minutes and then brush your teeth.
Look, she has a point.
Make no mistake, your partner's oral health affects your oral health. Here's what you need to know. Mouth bacteria are transmissible. So if you've just been to the periodontist for deep cleaning, did they tell you this? That your mouth bacteria, if you're kissing and living in close quarters with a partner, you are transmitting your bacteria to each other.
This is very interesting. Yes, we need to be aware of our social interaction. Whoever you partner with, it's just something important that we don't think about, depending on the stage of life we're in. But make sure that if you have any oral issues, if you have any gum disease, anything, you communicate with your partner, and both of you need to be treated. Yes, we do share a lot of things, and we share bacteria as well. But on the positive note, we also share good things in our immune system that we share as a herd as well, which is very, very interesting. But yeah, we do share bacteria.
I don't care whether you kiss on the mouth or kiss on the cheek, living within small space will do it.
Okay, one thing about this one that I want to mention, it's not just about your partner, but your kids. Your kids have such a clean, almost sterile environment until they come in contact with you. So be aware of that. Look after your health. So by looking after yourself, you're looking after your kids as well.
So what is the secret? Well, a guy wanted to kiss me one time, and I told him, get on my complete mouth care system for 6 months before you have any chance whatsoever. And I would suggest you do the same thing.
Yeah, I'm on my partner's case to check his oral microbiome. He's like, oh no, I'll do it another day. I'm like, I booked him in. Guys, that was fun. Thank you so much for watching. If you haven't watched our first reactions video, go ahead and watch that one. Place some comments. If there's anything else that you find controversial that you'd like me to talk more about, feel free to do that. I'm actually very grateful if you do it. Share this with your friends. Share with the people that you love and care about so we can all achieve better health. It's nice being here with you. I'll see you next time. Thank you for tuning into Mind Your Mouth. These episodes have been created for you. If you found this conversation helpful, the best way to support the show is by leaving a 5-star review on Apple Podcasts and Spotify. And don't forget to subscribe on YouTube so you never miss an episode. For more tips on holistic dental health, follow me on social media at Casuarina Dental. In the meantime, take care of your smile, take care of your health, and I'll see you in the next episode.